Well, we're talking in general today about controversial subjects, right? And certainly root canal fillings are extreme controversy. And there's been a lot of concerns about the root canal. And it's not just recent. Dr. Price really was one of the pioneers in the concern of root canals. He was a past president of the American Dental Association and a tremendous researcher and a humanitarian and a nutritionist. He said that basically what he had found in his early studies is that he would take an extracted root canal tooth and take some of that grindings and put it underneath the rabbit's ear, and he would find that if the patient, the donor from that tooth, let's say had a strep bacteria, that rabbit then would mimic or would develop the same kind of infection. So he found that there was bacteria present in a dead tooth living in the tubules themselves. A vital tooth, a healthy vital tooth, is made up of a canal on the inside with various blood vessels and nerves radiating inside the chamber of that tooth. And radiating from this canal are little tubules, microscopic little tubules in the dentin underneath this cap of enamel I mentioned earlier. That little tubules allow the fluid to come in and out of that tooth, balancing the hydrostatic pressure within that chamber, so that when there's swelling inside the tooth, we see a fluid coming out the tooth. Otherwise, we'd have a toothache all the time. So this exchange of fluids throughout the tubules in a healthy tooth is there for a reason. When we do a root canal filling, we take out all the canal, all the dead tissue. In the case of a dead tooth, we were to assume that if a tooth died, we would simply remove the nerves and the blood vessels and the abscess and all the dead tissue that was related to a dead tooth and fill it in with a suitable filling material. Now, assuming that filling material is suitable, Dr. Price showed that within these tubules that were once occupied by fluid, now they have become dehydrated, and then they become inhabited by microorganisms.